You brush your teeth, but what if one day you didn't? Not just for a night, but for good. Welcome to Spin of Facts, where today's dive explores the shocking chain reaction inside your mouth when brushing stops. From invisible bacterial attacks to painful decay, and even risks to your heart, this isn't just about teeth, it's your entire body on the line. Stick around, because this isn't your average hygiene lecture. It's a wake-up call, bacteria. Right after your last brush, bacteria begin multiplying at lightning speed. They cling to your teeth in a sticky film called plaque, forming the perfect breeding ground for acid-producing microbes. Within just one day, this plaque starts to harden into tartar, which brushing alone can't remove. These microbes release acids that erode your enamel and toxins that inflame your gums. The more you skip brushing, the more your body fights back, causing swelling, bleeding, and bone loss. This bacterial invasion doesn't just stay in your mouth either. Over time, harmful bacteria can enter your bloodstream, affecting vital organs. That simple act of brushing? It's your only line of defense against a growing colony of microscopic attackers determined to destroy your smile. And much more. Cavities. Cavities don't scream for attention until it's too late. When you don't brush, harmful bacteria feast on leftover sugars in your mouth, releasing acids that silently erode your tooth enamel. Small holes begin to form, often without any pain at first. But these tiny invaders dig deeper, reaching the softer dentin layer and eventually the pulp, where sensitive nerves live. That's when the pain hits: sensitivity, throbbing, or sharp aches while eating or drinking. Left unchecked, the damage can spread to your jawbone or bloodstream. Treatments range from fillings to root canals and even extractions. And the cost? It adds up quickly. All of this from skipping the simple act of brushing. Cavities don't just affect your teeth, they affect your wallet, your comfort, and your long-term health. Gum disease? Gingivitis is the first red flag. Your gums start to look red, feel sore, and may bleed when you floss or chew. But without brushing, it gets worse. Fast. Gingivitis evolves into periodontitis, a deeper infection where bacteria form pockets under the gums. Your immune system attacks the infection but damages your bone and connective tissue in the process. As gums recede, teeth loosen and may eventually fall out, and the impact doesn't stop at your mouth. Studies show gum disease increases the risk of heart issues, strokes, and even Alzheimer's. It's not just bad breath or bleeding, it's a serious chronic infection. Brushing and flossing daily is your best weapon. Don't wait for your gums to retreat, because once they do, they rarely come back. Bad breath, there's morning breath, and then there's halitosis. When you stop brushing, your mouth becomes a breeding ground for bacteria that thrive in dark, oxygen-poor spaces. These bacteria break down proteins and release foul-smelling sulfur compounds. We're talking about gases like hydrogen sulfide, yes, the one that smells like rotten eggs. As plaque and tartar build up, your breath becomes permanently unpleasant. Chewing gum, mints, or rinses may mask the odor briefly, but they can't address the root cause. Chronic bad breath affects more than just hygiene. It hits your self-esteem, social life, and confidence in personal interactions. People might not say it out loud, but they'll notice. You can't outsmart halitosis without brushing and flossing. The stink doesn't just come from your mouth. It's a warning sign that decay and disease are underway. Miss one night of brushing, maybe nothing changes. Miss weeks, the odor becomes part of who you are. Stained teeth. Your smile is one of your most powerful features, but stop brushing and it fades fast. Plaque doesn't just harm your gums. It collects pigments from coffee, tea, tobacco, and wine. These pigments settle into the sticky film, staining your teeth yellow or even brown. Over time, stains penetrate your enamel, becoming harder to remove and often permanent. What used to be a quick selfie smile, tartar buildup around your gum line, adds to the discoloration, making teeth look dirty even when they're not decayed. Whitening toothpaste won't help much once the damage is deep. Professional cleanings may remove some stains, but restoration costs go up quickly. The takeaway? Your toothbrush is the simplest and cheapest beauty tool you'll ever own. Tooth sensitivity. Once your enamel thins from acid attacks, the inner dentin becomes exposed. This layer is full of microscopic tubes that lead straight to your nerves. Suddenly, drinking cold water or biting into ice cream sends a sharp jolt through your tooth. Sweet foods or acidic drinks become torture. At first, you might just notice a little tingle. But without brushing, that sensitivity worsens fast. Cavities deepen, gums recede, and even breathing cold air can become painful. Over-the-counter toothpaste might dull the symptoms, but only dental intervention can fix the root problem. And if pain persists, root canals or crowns might be necessary. It's a painful, expensive cycle, all caused by skipping those crucial 2 minutes twice a day. Sensitivity is more than annoying, it's a warning signal. Total body impact. Poor oral hygiene doesn't stop at your mouth, it travels. When bacteria from gum infections enter your bloodstream, they trigger inflammation that affects your heart, brain, and even lungs. Studies show that gum disease increases your risk for heart attacks, stroke, and clogged arteries. For people with diabetes, it worsens blood sugar control. Pregnant women with gum disease may face higher risks of premature births or low birth weight babies. There's even growing evidence linking poor oral health to Alzheimer's disease and respiratory infections. Your mouth isn't an isolated system, it's connected to every major organ. Skipping brushing may seem harmless, but the consequences echo throughout your body. A clean mouth supports a healthy heart, brain, and beyond. Think beyond teeth. Your health depends on it. Cost of neglect. Skipping brushing might feel like saving time, but it'll cost you more financially and emotionally. A tube of toothpaste costs a few dollars. A good toothbrush? Maybe $10, 0 cents. But a root canal? Easily $1,000, 0 cents or more. Dental implants can reach $4,000, 0 cents per tooth. That's not counting time off work, painful procedures, or follow-up visits. Cavities, gum disease, and tooth loss are preventable. But the longer you wait, the more expensive the fix. And it's not just about money. The pain, embarrassment, and inconvenience take a toll on your confidence and lifestyle. Prevention is cheap, but neglect is costly. Investing a few minutes each day in brushing and flossing protects not just your smile, but your future. Don't pay the price for shortcuts. Your health is worth more. Recovery. If you've been skipping brushing, don't panic, but act now. The body can heal, especially in early stages. Gingivitis can reverse with consistent brushing, flossing, and mouthwash. Superficial stains and minor plaque, a dental cleaning can handle those. But tartar requires professional removal. Cavities, they'll need fillings or crowns. In advanced cases, root canals, gum surgeries, or even tooth replacements may be necessary. The sooner you return to brushing, the better your chances at stopping or reversing the damage. And it's not just physical. You'll regain comfort, confidence, and control. Brushing daily may feel basic, but it's powerful. One habit can repair years of neglect. So start fresh today, because every brushstroke now is a step toward restoring your health and smile before it's truly too late. Prevention power. Creating a solid brushing habit isn't hard, it just needs consistency. Brush twice a day for 2 minutes with fluoride toothpaste. Add flossing or interdental brushes to clean between teeth. Replace your toothbrush every 3 months, and don't skip those dental checkups. Sounds simple, right? But life gets busy and routines slip. That's why building cues helps. Brush right after breakfast and before bed. Pair it with music or a podcast, or use brushing apps that gamify the task. If motivation lags, remember what's at stake. Your smile, your confidence, your health. Prevention is easier than repair, and a strong routine turns brushing from a chore into a no-brainer. Teaching kids early, setting reminders, or brushing together as a family can also reinforce the habit. Bottom line, brushing isn't just dental care, it's self-care. Make it part of your day like breathing, because your future self will thank you. Thanks for watching today's video on Spin of Facts. If this video made you think twice about skipping your toothbrush, then mission accomplished. Remember, small habits lead to big results. Got thoughts or questions? Drop them in the comments. I read every single one. Share this with a friend who needs to see this. Subscribe now so you don't miss what's coming next. Trust me, it's worth it. Your next health wake-up call might be just one click away.